Hello, this is Anne DeGheest from Anne Inside. This is December the 18th, 2020. And this is Anne Inside channel on YouTube. We have two videos this week, and they're both really critical. On the first one, we are going to see how the US is shattering all records. 250,000 daily cases on the average, over 3.4 thousand people who are dying on a daily basis. This is worse than a 9/11 on a daily basis. Meanwhile, Europe is bending the curve. It can be done. We need to do it. The US can do it. In the second video, the clinical one, we are going to be looking at the vaccines rollout, what's happening with the vaccination, who is going to get it, in what order, what are the problems in getting the distribution and logistics. Two new at-home tests have been approved, so we're going to review that. And we'll do a quick review at the end on how to avoid being infected with COVID, since the next couple of weeks are going to be horrific for the US. So I also want to wish you a really happy 2021. We cannot wait to get rid of 2020. Please stay at home, be safe, and I'll see you on January the 8th, 2021. Thank you for listening and spreading the world. Thank you. Okay. Hello, this is Anne DeGheest. This is December the 18th. This is our first video on epidemiology. I hope you're all safe and healthy. We have a lot to talk about this week. Some really good news and some really bad news. It's like the light is the darkest before the dawn. So on the first video, we're going to be talking about the shattering of the records in the US. It's mind-boggling. We are doing 250,000 daily cases. We have on Wednesday 3,400 people who die. That's the peak ever. And Europe is doing a good job at bending the curve, so it can be done. We just need to focus in the US on really doing the right thing. You can really see in this curve there that Europe is doing a good job curving. They have a bit of a bounce back, and we'll talk about that. Where in the US, we're straight up. I mean, what you see here is a bit of the Thanksgiving, which may be more of a data reporting issue. In the second video, some great news. Moderna just got approved literally 10 minutes ago. So we now have two vaccines, but we're going to discuss what are the issues in getting access to the vaccine, when do you get it, what's the rollout, what are some of the issues that already have emerged with the vaccines. And we'll talk about two new at-home tests that have been approved by the FDA, and we do a quick recap on some news on the virus and other subjects. So let's go on the epidemiology. The world has grown since I've talked to you 2 weeks ago from 64 to 75 million cases and 1.6 million deaths. And you can see it's really North America, which is the US, driving the growth, which of course with the Europe had that explosion. So globally, 75 million cases, 17 million in the US. India is going to pass 10 million probably by tomorrow. We are still growing on a global basis at the rate of 8% on a biweekly basis there. So we are literally adding 750,000 cases per day. These are mind-boggling numbers. So daily cases, the US has gone up 17% in the last couple of weeks. We are now at 652 cases per million. And you're going to see, it continued to climb. So unfortunately, there's absolutely no slowdown in the US. But the good news, we'll talk a little bit about Europe because there's lessons to be learned there. You can see Europe is really doing a good job. France, which was galactical for a while at over 800, as well as Belgium, has controlled it. So let's kind of take a quick look about Europe. And after, of course, we review the US, which will spend more time there. Brazil has a resurge. Both countries are not really putting too much control and restrictions. So you can see the bounce back that was coming from the winter surge that we all expected. Germany is going to put more restriction there. They were never able to control it like France and some of the other European countries. And so they're being much more restrictive for the next 3 weeks. And the UK is also having a bounce back. Overall, this is a graphic that tells it all. This is the number of cases per million people, so it's normalized by the population. You can see Europe was taking off, typically a month before we do. They put high restriction there. They really control within a period of a couple of weeks. They start easing up, and now it's coming back up. And we'll talk about some of the restrictions they're putting back in place. In the US, we really are not controlling it. You can see it's straight up. This is just a Thanksgiving data problem, I think, but it's clearly carrying up. In California, I will explain, has absolutely exploded. So in Europe, you can see that Switzerland, Italy, Belgium, and France that had this massive problem in October there have done a really an amazing job in controlling it. I mean, they literally have dropped the infection rate by a factor of 3 to 4x, depending on the countries there. So restrictions do work. There is a concern. You can see there's a little bit of a bouncing back, and as a result of that, they're putting more restrictions in place. Their infection rate is still very high. Switzerland is at 16%, which means two things: they're under testing or they really have a massive outbreak. The goal, if you remember, for the World Health Organization is around 5%. So the Swedish herd immunity concept is clearly debunked. If you compare the US and Sweden, both of us had a bit of a laissez-faire attitude from a political point of view. You can see that they both, they both went down, and right now Sweden is at the same growth rates than the US is, and they finally are putting some restrictions in place. Mortality has been flattening there as a result of the measure, but you can still, countries like Italy, which had a huge surge in the spring, are having still some really high mortality rates. So this is not just infection in young people there. The mortality rate, unfortunately, 2 to 3 weeks later has spiked as people were afraid of. So as a result of this little bounce back, Germany has announced from December 16 to January the 10th that they've seen a 10 times daily increase since October. As a result of that, they've closed the school and all the non-essential stores. People have a lot of restriction on visitation. Maximum of 5 people from 2 households can get together. In the UK, 34 million people under tier 3. UK is a bit more complicated because they have different rules for England and Scotland and Ireland. So it depends where you're going there. But as a rule of thumb, there's restriction on traveling and indoor gathering. The Netherlands, which for a long time was a bit like Sweden, really in denial of putting restriction, had this huge spike. And now they finally put some restriction in place with non-essential businesses closing. School must switch to remote learning. Gathering are limited to 2 people, even outdoors. And then France, they have eased up a tiny bit of restriction, which means the curfew is only starting at 8 o'clock, which is still pretty early for the French. And this is something that I learned from speaking to some of my friends there. You have to have an exemption certificate. And so if you go on that website there, you have to basically explain why you're outside your door, why you're in the street, and any cops can basically ask you that. And if you don't have it, you get 135 euros fine, which is around $150, so it's not negligible. And some of the excuse could be you can have an outdoor walk, and that could be at most 20 kilometers from your house. You have a family emergency, you have to explain what that is. You're doing shopping for food, or you're picking up your kids for school. And everybody has to fill this up every time they leave their house. So much more restrictive than what we have here. In addition to that, all the bar, restaurants, and nightclubs are scheduled to remain closed until January 20th. So if we complain in the US, Europe is under much more restrictions than we are. But you saw that they had this massive spike and they managed to control it. And, maybe there's some lessons for us to learn in the US. So as a result, if you look at the new weekly cases per million, which is this column here, you can see now the US, unfortunately, is pretty much one of the highest level in the world. Belgium, if you know, has been leading this crisis for the last 9 months, but that could be an issue that much more honest in reporting the confirmed cases and mortality than some other countries in the world. But this is the bad news. Look at that number. New cases per million, 747, except for Slovenia, which has a much smaller population. We're one of the highest in the world. So Eastern Europe, Serbia and all those countries have been hit really hard too. Croatia and all of that. So this is a global crisis, and we need to learn from what other people are doing. So let's look at the US metrics. In the last 2 weeks, we have increased at the rate of 18% in the number of cases, but this was the thing we didn't want to see. The mortality has gone up 39%. We are now seeing a level that were significantly higher than during the spring crisis there. And this is a problem. We got to talk quite a bit about it. The hospitalization has gone up 16%. And now we have ICU bed problems and bed capacity problem across the US. To get perspective, only 291,000 people died, combatant deaths, in World War II. We have passed that number. So in the last 9 months, 310,000 Americans have died, which is more than in the 4 years of the war, of World War II in American soldiers. It is mind-boggling. At times we get so desensitized. I think I just want a reality check. We basically have like a 1 in 9/11 per day happening. So let's look at the records. Daily tests, we're still going up. We still don't do enough. Daily cases, it's a vertical. It's absolutely, maybe there's a bit of a slowing down, but it doesn't really look that great. Hospitalization is a massive problem. It's much higher than what we had in the spring. And as a result of that, daily deaths now is breaking record. You can see that the averages is over here, but we get a spike at close to 3,500 cases. So our peak, which was on Wednesday of 3,435 deaths, is the equivalent of 5 deaths per minute. And again, it's a reminder of this is more than 9/11 on a daily basis. It is staggering. There was a report showing that over 50% of Americans know somebody who ended up being hospitalized or who has COVID. So let's look where it's happening there. 2 weeks ago, and when we talked, this was the Midwest was really lightening up. Now what we're seeing is the whole California, especially Southern California, has gone up by a factor of 10x. We'll talk more about this. And unfortunately, the East Coast is also going back up. Let's look at some numbers. California has gone up 137% in the last 2 weeks. The US as a whole has gone up by 20%. So these are very numbers we don't want to see. But this is the worrisome part. The state with very large population there, North Carolina, Virginia, Georgia, Arizona, Pennsylvania, the whole East Coast there, very big growth. And so that explains why our numbers are so high. Remember, we've been keeping track of the highest daily cases per state, and we continue to break records. And so it is really nationwide. It is not just like what we had in the past, where we had a few hotspots moving around the US. Now the whole country is unfortunately spiking up. So as a result, and this is what people are very worried, is mortality will go up because the hospital beds and the ICU beds are constrained. People are in surge mode. People are doubling up. They are putting basically hospital beds in cafeterias and other area there. And you can see that New Mexico has pretty much no capacity. Alabama, Georgia, all of that. Typically, we'd like to see a 67% capacity utilization in the ICU to be able to handle, a surge or an accident. And right now, if you're having a heart attack, a stroke, or anything that requires hospitalization, you may not have the possibility of finding a bed. So it's not just for COVID; it's for whatever other medical problems that we may have. As a result of that, please be ultra safe in the next several weeks. In general, just because you don't want to have an accident right now. So really, unfortunately, California, if you remember 2 weeks ago, was doing fine at 70 something, and now we're at 83%. We'll talk more about that. So the Midwest is doing a little bit better there. You can see that it's going downwards there, but the rest of the country is straight up. And you can see hospitalization, which has a typical couple of weeks delay, is following straight up a similar curve, with the slight delay that happens there. So unfortunately, these are very, very significant number. And you compare this to the Northeast, which had a spike in the spring, we are way above those numbers in a different part of the country. So it is unfortunately like in 1918, the second wave is going to be worse, significantly worse than the first wave. So California, what happened? I'm speechless. We literally have gone up by a factor of 10x since November the 1st. I mean, think about this, 6 weeks, 7 weeks. We have gone up by a factor of 10x. And literally we're around 3,800 cases in early September there. We're 38,000 cases now per day. The positivity rate, which we're all bragging about to be in the 2 to 3% there, is now at 13%. So it is a significant outbreak. We just had today 21,000 deaths on a cumulative basis there. Los Angeles is the epicenter of the whole crisis in the country right now. They're the hottest spot. And today, for 2 days in a row, we just passed 300 deaths daily in California there. So we just lost it. And what I've read is that we don't fully understand it. I think everybody says COVID fatigue. It's not really the Thanksgiving consequences yet, because basically Thanksgiving is going to be starting to hit probably next week is when the expectation is. So we should expect this to get significantly worse in the next couple of weeks. So we're going to need to be very, very careful and patient in the next 2 to 3 weeks. So let's look at different part of California, and these are like stunning explosions. You can see how quickly this happened there. I remember I was telling you in November, we were like, we're bragging, we were great, we were the best state, and boom, it just took off like a rocket there. It's absolutely astonishing there. Southern California is clearly driving the explosion there. The Central Valley, San Joaquin Valley there is next behind it. But Bay Area, which is where several of us are in Northern California, we are following the same trajectory there. We may be a couple of weeks behind them, but we're going straight back up. So what that means is that we are losing our ICU availability. Southern California had no ICU beds, period. Where they're now basically sending people and all of that, including Northern California there. The San Joaquin Valley is pretty much zero also. And I just read that there's only 15 beds available in the ICU in Santa Clara. So pretty much we're in trouble. The positive rate, you can see, is unfortunately has gone from 2% to 11% in the matter of 4 to 6 weeks. So we need to do something. That's why pretty much the whole state right now is in lockdown. 99% of the state is in shelter in place, even stricter than what we had before. And we have to do something because the healthcare system is totally overwhelmed. And it's not a question of beds, it's that they don't have enough healthcare workers. They can add extra beds and put tents and all of that, but they cannot add extra nurses. And what that means, this is what we learned in New York, is when the system is overwhelmed, mortality goes up because they cannot get the best care available. Because you now need to maybe get 2 nurses working on 4 to 6 patients instead of a ratio of maybe 1 COVID patient in the ICU per nurse. We're in trouble. The Bay Area right now is still quoting at 13%, but that's because it's including some of the northern area there. But Santa Clara, just hit a very low percent of ICU available, and it literally in a matter of a week. So we're back up. It's not good. It's not good. We need to do something. What's driving it? The young population. We've been talking about this for a while, but the majority of the cases, 59% of the diagnosis cases, people between the age of 18 and 49 years old. And the problem is that they transmit it to the elderly, and within a couple of weeks, you have the mortality rate, which is the people over the age of 65 years old. That's the transmission. So we all need to step up, not just for ourselves, but for our loved ones, and then the people who can accidentally transmit the disease too. So America is suffering, and not only on COVID, but it's an economic crisis. The poverty level went up to 11% in the US. We got an extra 8 million people since June. We've doubled the largest annual increase since 1960. So we're having a major economic crisis. 12% of Americans are going hungry. That's around 27 million people. This is the best country in the world. How can this happen? 35% of Americans have trouble paying their household bills. This is bills to live, not to go to the movie theater. That's 85 million adults. And 9% of Americans have a problem paying their rent and their mortgage, and they're behind in paying those things. So we need to help. This is just the whole country. We're at war. This is like World War III with an invisible enemy, which is this virus. We all need to step up and do the right thing. This is a stunning number. I had to read it twice, is that 77 million adults expect somebody in the household to lose a job in the next 4 weeks. There's so many layoffs, so many companies are finally giving up, that this 31% of American households expect somebody within their household to lose their job in the next 4 weeks. That is absolutely incredible. So we are going for a major recession. I think we're going to get hit. But I want to be positive. I'm trying to find positive story. We have done it before. There's this fascinating story in the New York Times that shows that in 1947, in New York, they vaccinated 6 million people in 2 weeks. So what happened, they had a case of smallpox of somebody who took a bus all the way from Mexico City to New York City. And he came up with smallpox, and unfortunately he died, and then other people got contaminated. They had only 12 infections and 2 deaths. The whole city, in a matter of 2 weeks, thanks to one individual, this person called Israel Weinstein, who basically, he got all the doses from every military base in the US. He purchased 2 million doses from private labs, and he managed to convince all the New Yorkers in a period of 2 weeks to get vaccinated. We can do it. For God's sake, they did it in a matter of a few weeks. And look at the lines. I mean, people were really dedicated. This was April and cannot be that nice of a weather there. So we've done it in the past. We can do it again. And they did it, which was a much smaller infection. So when the vaccine comes and it's your role, we'll talk more in the second video. Please take it. So I wanted to wish you a happy virtual holiday. Stay safe. We cannot wait to get rid of 2020. Hopefully 2021 will be better. And my next video will be on January the 8th. So please be safe during the holiday. And make sure you watch the second video on the clinical, where I'm going to spend more time on the vaccination and the rollout.